What does depression look like? How do you know you're depressed? What are the symptoms of depression? What are the options for treatment? Medications, therapy, ketamine, TMS, psilocybin? Now, some people know when they are depressed and can list the depressive symptoms they're experiencing. On the other hand, some others may know they don't quite feel right but cannot place their finger on precisely what's going on. So they might say things like, I feel heavy, I'm not myself, I feel sad, or I feel empty. Some others may even say, I no longer want to be here, or I wish I were dead. According to the World Health Organization, depression, one of the most common mental disorders worldwide, affects over 260 million people. Mental health clinicians diagnose psychiatric disorders using the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5 for short. Even though we generally refer to this illness as depression, the correct terminology, according to the DSM-5, is major depressive disorder. This condition is also sometimes referred to as unipolar depression, different from bipolar disorder, which I will discuss in a later video. Diagnosing depression does not require investigative procedures like blood tests or brain scans. There is, however, a cluster of symptoms associated with depression. To be diagnosed with depression, you need to have 5 or more of the following 9 symptoms during the same 2-week period. These symptoms have to represent a change from your previous functioning, and at least one of the symptoms is either 1, depressed mood, or 2, loss of interest or pleasure. These 9 symptoms are depressed mood most of the day. Some people may describe this as feeling low, sad, tearful, empty, or hopeless. In children and adolescents, they may have irritable mood. Decreased interest or pleasure in things you previously enjoyed. This is called anhedonia. Examples include an avid golfer giving up golfing because he no longer enjoys it, or giving up regular walks with your dog because you no longer have the motivation to do this, or giving up reading that you previously enjoyed. Significant weight loss when not dieting, or weight gain. This is usually a weight change of over 5% of your body weight in 1 month. Other than the weight changes, it may also be a decrease or increase in appetite. Sleep changes. This can present as trouble falling asleep or staying asleep, known as insomnia. In some cases, you may have the opposite, which is sleeping excessively, known as hypersomnia. Feeling very sluggish or restless. This is what we refer to as psychomotor retardation or psychomotor agitation. Fatigue or loss of energy. You feel exhausted and are not motivated to do anything. Some people describe difficulty getting out of bed or even caring for their personal hygiene. As a result, routines like brushing your teeth and taking a shower feel like a huge chore. Feelings of worthlessness or excessive or inappropriate guilt. In some cases, this may be delusional, which means they're fixed beliefs that do not change even when a person is presented with conflicting evidence. Decreased ability to think or concentrate. As a result, it may be harder for you to make decisions and focus on work and personal life. This may also mean you struggle to remember things, which can present as memory problems. Thoughts of dying or even killing yourself. Suicidality can be passive or active. Some people may have no intent or plans to kill themselves, but they will be okay dying in a car crash or from a medical emergency. This is passive suicidality. Active suicidality, on the other hand, refers to when someone cultivates a concrete plan of how they could kill themselves. Suicidality should never be taken lightly, as it is an emergency requiring treatment in an emergency room or psychiatric hospital. So if you have at least 5 of these 9 symptoms and they continue for 2 weeks or more, you're likely suffering from depression. Also very important is how much all of these symptoms affect your life. Do these symptoms affect your ability to do your work, attend school, or take care of yourself or your kids? Depression may affect your ability to interact socially with others or hinder other important areas of your life. This is what we refer to as functional impairment. Depression presents as a spectrum, which means we can have someone who has some depressive symptoms but is still able to get themselves out of bed, go to work, and participate in life activities. In fact, people around them may not know they're depressed, but inside they feel down, empty, and unhappy. On the other hand, you may have people who are not motivated to get out of bed, brush their teeth, or even shower. So depending on the number of symptoms and the severity, depression can be categorized as mild, moderate, or severe. Even though depression can be debilitating, the good news is that there are available treatment options. Treatment modalities include therapy, medications, and esketamine or Spravato. There's also electroconvulsive therapy or ECT, as well as transcranial magnetic stimulation or TMS. Even though not approved by the FDA at this time, numerous research are going on with psychedelics like psilocybin, ayahuasca, and LSD. I'll discuss various treatment modalities like TMS, esketamine, and research psychedelics in a later video. Thank you for watching.